let's get to Israel. Since the world has started its vaccination campaign, Israel has seemed to be one step ahead of everyone else, and now there is talk of them potentially reaching "quote unquote" herd immunity thanks to vaccinations. Let's check in on life in Israel, and we're so happy to join once again Professor Nadav Davidovitch, director of the School of Public Health at Ben Gurion University in Israel. Professor Davidovitch, thank you so much for coming on the show.
Thank you for having me again. We just had Independence Day yesterday.
Yes.
And comparing to last year, where things were all closed, now we are almost back to normal. Also, from next week, schools are going to be totally open. And indeed, it's amazing to see, the effect of the vaccines here in Israel.
Paint us the picture of life. You told us about the schools, and I would love to know, Dr. Davidovitch, about going to restaurants, going to a bar. Tell me what's happening. Are you going to concerts? Tell me about life.
So I'm just walking yesterday. Restaurants are now totally open. When you're sitting outside, you can be without vaccines. If you're sitting inside, so you can be there with the green pass. It means that either you're vaccinated, recovered, or you present a recent either PCR test for 72 hours or a rapid antigen test. And this green pass, with all the ethical discussion, I think it's proportionate. It's being used in concerts, sports events. In this coming week, many theaters are reopening, again with some limits, even for vaccinated people. But the atmosphere and it's really like almost returning to normal. I think the most important for me is the total reopening of schools. This was really very tough for children this last year. For all of us, of course, but especially for children.
I can imagine. Now, Dr. Davidovitch, what is the percentage of the Israeli population that has received at least one dose of vaccine right now?
So it's now about 55%. And on top of that, you can add those who recovered. So probably the estimate is that about 60% of the population now either recovered or vaccinated. We are not into herd immunity yet because we still see about 100, 200 cases per day. Again, we were one of the highest in the world just a few months ago with 8,000. Again, it's a population of about 9 million people, so the rates were extremely high. To give you something that is more comparable, we have now about 0.5% of tests that are positive. We were about 13, 14% just a few months ago, and the number of severe cases in the hospitals going down. So what we see now is a kind of indirect effect of the vaccines. To get into herd immunity, we'll need still to vaccinate children. I participated 2 days ago with a large Ministry of Health meeting. We are waiting to see the approval of the FDA, and I myself sitting on one of these committees for approving vaccines for children aged 12 to 16. Until now, we gave only for those who are in high risk children, about 800 of them, and it was received very well. And then probably we can discuss, more about herd immunity and reducing the number of cases even further. So we are in a kind of a new normal right now. We cannot get to herd immunity also without the Palestinians being vaccinated. There is a Supreme Court petition. All the public health community is supporting this, but unfortunately, because of the political situation, only Palestinians working in Israel were vaccinated, and I hope that soon this also be solved. I think it's our moral responsibility and also our Israeli interest, of course, to have them vaccinated.
We're with Nadav Davidovitch, director of the School of Public Health at Ben Gurion University in Israel. Professor Davidovitch, you said around 55% is vaccinated right now in Israel. Can I ask you what is the hurdle for Israel right now to getting to 75, 80%? Is there vaccine hesitancy in your country?
Yes, there is some, although I guess that comparing to some European countries, like France and Germany, in general, vaccination rates in Israel are quite high. It's embedded in our culture. We see vaccination, many of us, not just as an individual choice, but also an act of solidarity. We had some problems with the ultra-Orthodox community and our population. Then we invested lots of energies doing both top-down but also bottom-up with religious leaders. But there is a very small nucleus, some percent, that are not just vaccine hesitant, but also resisting vaccination on many different reasons. Like in other countries, some maybe are anti-vaxxers because of some new age ideas, some maybe because of religious ideas. But in general, we invested lots of energies, and those who are eligible right now, we are talking about 200,000 people that are above age of 50 that are the main target now because they are high risk. But I don't think it should be, used with compulsion. I think the Green Pass is a kind of a nice, proportionate way of bringing people to be vaccinated, nagging them, giving the alternative of doing tests. But, after you're doing several tests, and if you're just hesitant, you're kind of convinced. And you see also the effect of the vaccine in Israel, that is very efficient and complications are extremely low.
I have one quick question for you as we wrap up this interview. Here in Quebec, we're at 25% of the population that's been vaccinated. Our issue is supply. We don't produce the vaccine in Canada, so we have to rely on shipments. We're at 25%. What would your message be to a country like Canada that is working at it, but we're at 25%? What would be your parting message for today to the people listening?
Please go vaccinate. It's saving lives, and it's also for your community. Here in Israel, we see how returning to normal was brought mainly by vaccines. And I think that for all of you, going back to restaurants, bars, just, the normal things we were doing, I think this is a very nice idea. And again, it's also saving your life. So go and vaccinate.
Doctor, you have been such a great resource for us now, our third interview, and I want to thank you again for joining us. I really do appreciate it.
Thank you so much. Lots of help.
That's Nadav. Same to you. That's Nadav Davidovitch, director of the School of Public Health at Ben Gurion University in Israel.